Hello and welcome to this COVID-19 update for you and your community here on the Bass Coast. My special guest today is Louise Sparkes, who is the Chief Operating Officer from Bass Coast Health. Louise, hello.
Hello, Kevin.
Nice to have you with us.
Thank you.
We know that maternity is moving from the Wonthaggi Hospital to Foster. Louise, I wonder whether you could tell us exactly why that's happening.
So as part of our response at Bass Coast Health to the COVID-19 pandemic, we've looked at what services are probably more vulnerable and what populations we need to move to a safe place. And those two populations are the maternity service and our geriatric aged care service. So we're moving one to Foster, which is our maternity service, and we're moving the geriatric service to Leongatha and Currumbara, in order to have them removed away from the COVID positive patients so that they're in a safe environment. And it also means that we're not moving all our services to another hospital, because that puts a lot of pressure on them as well.
And it also gives Bass Coast Health more room for COVID-19 patients. We have to look at that seriously and know that that is a possibility, so the service needs to be there for them.
Absolutely, that's probably another really important reason why. So it's not just about the safety, but we also know that through this pandemic, we'll have more people that will become unwell with respiratory conditions, and we'll need more hospital beds to look after them. And so by moving those services out, it actually gives us a greater capacity to look after the community, and we'll be up to around 80 inpatient beds. So we'll be able to look after the COVID positive patients from the whole sub-region, not just the Bass Coast area.
What if an emergency arises, Louise, and there is a patient coming in, a mother coming in with an impending birth? What happens then? They're coming to Wonthaggi. Where do they go?
So absolutely, we'll still have birthing facilities, and we'll still have a birthing suite for those mothers. We'll still be able to manage any obstetric emergency or anything we normally would, and we'll certainly be able to provide care for women that are pregnant that are COVID positive during this time. We've set ourselves up so that we've still got those facilities available.
Well, speaking of babies and children, for that matter, what prevalence of COVID-19 are there in young people? There's been a lot of news about that over the past week or so.
So the prevalence is the same for the rest of the population in young people. It's just the very young infants that probably are more vulnerable to infection because of their age.
I've had the privilege of sitting in on many meetings now at Bass Coast Health, and everybody's doing an amazing job. And you, as the operating officer, right on the coalface to know that the preparation that's going on presently is quite incredible, isn't it?
Oh, absolutely. I think that, there's a lot of us working day and night to get ourselves ready, and it's all just so that we can make sure that our community is safe and that we can provide care and we don't end up in a situation like we're seeing overseas. We're lucky in Australia, we've had a little bit more time to prepare, and we've been able to learn from some of the situations they've found themselves in Italy and the USA, and we're trying to use all those learnings in everything we're planning. So we'll have, next week we'll have an ED that's for people that have respiratory conditions. It'll be separate to the ED for people that have non-respiratory conditions, and we're just trying to really control the spread of COVID, not just within the hospital, but also in the community, and get our messages out. It's a really important role of the hospital.
And Louise, do you have any advice for expectant mothers to lessen the risk of COVID-19 in their newborn?
So Kevin, it's really important that they just continue to do all the things we are doing, the social distancing, the hand hygiene, the cough and sneeze into your elbow, keep away from people that are unwell. All those things are really important for them and for all of us. But I guess if you're a pregnant woman, it's really important that you make sure that you attend your antenatal classes and your antenatal appointments. You might find they're a little bit shorter and that they might be done by telehealth, some of them. And if you have any concerns about your pregnancy, for example, you feel like your baby's not moving as much as you normally would, you should still contact the hospital and seek advice from the team to make sure the baby's okay. So that all needs to continue as it normally would.
Louise, thank you very much. Your time is precious. Appreciate you sharing your knowledge of the latest conditions from Bass Coast Health. And the move to Foster is happening now, isn't it, for maternity?
Absolutely. So we've been working really hard with Foster over the last 2 weeks to get this happening. Some of the Bass Coast Health midwives will be joining our mothers down at Foster. We moved our equipment down there yesterday, so we've moved half of our equipment down there, so they've got enough room and they've got a second birthing suite. and we'll start moving our mothers down there from the end of this week.
Thank you, Louise. Louise Sparkes, Chief Operating Officer from Bass Coast Health. Now, Bass Coast Health believes we will get through this, but we need to do the right thing by yourself and everybody else, family and friends and neighbours. You'll find a lot of information at basscoasthealth.org.au. Thank you for sharing us on Facebook. We hope you continue to do that. The more we get the messages out, the more people know that we need to look after everybody else. Until I see you again, take care.